Oh, well, welcome to another one of my interviews. Today I'm speaking to the lovely Aly Dilks, who is an advanced nurse practitioner, a menopause specialist, and the founder of Simply Menopausal. So thank you so much for joining me today.
Thank you for inviting me.
It's lovely to speak to you. Do you want to explain what it is you do and how you got into sort of being a menopause specialist and the work you're doing now? Because you'll do a better job than I will.
Of course. So my name's Aly Dilks and I've been a nurse for 37 years. Most of my career has been in women's health. And then about 15 years ago, actually, I was working as an advanced nurse practitioner in a GP surgery that had female GPs. And around that time, I had a hysterectomy myself. I was a single parent with 3 teenagers. So obviously, I wasn't off work for very long. I went rushing straight back to work. And because all the doctors I was working with were male, any women that had any problems seemed to make appointments to see myself. And I seem to find it was a bit of a common theme, really, women struggling with fatigue and brain fog and low mood, all symptoms that I was struggling with, but I just presumed it was because I was working full time, had 3 children and I just had quite major surgery. So, and then I began to put 2 and 2 together and think, hang on, there's some sort of connection here. Because when I had my hysterectomy, nobody mentioned HRT to me. So I did a little bit of research, decided that perhaps I was menopausal, went to see my GP who agreed and gave me some estrogen. And within weeks, I just felt back to my old self. I had my energy, I was sleeping, the hot flushes had gone, the low mood had gone. And I just had all my energy back. And the brain fog that I was really struggling to work through just suddenly lifted. So I suddenly realised that was what the menopause was. And I'd been plunged into a surgical menopause without anybody really warning me what was going to happen. So that's probably where my interest started. I did lots of training around the menopause. I joined the British Menopause Society and I did their extensive training. And so I'm now officially a British Menopause Society accredited specialist, which means I've done lots of specialist training to help me deal with more complex cases as well. Mm. And then about 3 years ago, I had this vision to open a private menopause clinic because I realised that even though I was quite knowledgeable about the NHS, just the average GP appointment is 7 to 10 minutes long, and it's just not long enough to talk about all those different complex needs that women have and to explain why they feel like they do that before coming up with a plan. And so I now offer 45-minute consultations for women to talk about their own personal menopause journey, their past medical history, and to explain why they feel like they do, the long-term health benefits of HRT, and how actually the risks are much less than women probably realise. And I come up with a plan, and then I write to their GP at the end of the consultation with my plan, because everything that I prescribe is available on the NHS and follows NICE guidelines.
Oh, that's brilliant. And like you say, when you have 7 to 10 minutes, all the different symptoms of the menopause, it just depends which ones the patient chooses to say, I guess, and that's why so many people are misdiagnosed as well, isn't it? In that short space of time, you can't possibly diagnose.
No, and that's it, because with fluctuating hormones, some days you've got low mood, some days you haven't, some days you have hot flushes, they may disappear. There's just so many different symptoms and they just change all the time. It's quite difficult. And so, it's quite hard to get through on the phone to GPs because they are so overstretched. So when you finally get in, or you may be having a phone consultation, and then so many women just burst into tears and the GP just goes, oh, you're depressed. Antidepressants, off you go. And that's without having time to pick away at all those different symptoms and actually ask questions about what else is going on in your life as well.
So if somebody was going to the GP because they maybe hadn't realised themselves, or maybe they'd started to think they were going through the menopause, if they're going to the GP, what's the best thing they can say? Is it better to go and say, I think I'm going through the menopause to start with, to sort of almost get them thinking along that track, just to help them get that diagnosis in that short space of time?
Definitely, you need to do your own research. There's lots of apps now. You can sort of track your period, so you can see if there's a change to your period cycle. Although with a lot of contraception, women don't have periods, or some women do still have regular cycle during the peri-menopause. So it's not just about periods, but keep a track of your symptoms. There's something called the Green Climateric Scale, which was invented by a guy, Professor Green, and it just lists all the most common symptoms of the menopause, and it's a really good way of keeping a record of what symptoms you've got and how they're affecting you. You can score them, and so you can see which are the most troublesome symptoms that you've got. But I think you do just have 7 to 10 minutes, so it's just be prepared, do your research, look on websites, and go on the British Menopause Society website, You can have a look on my website, Simply Menopausal, or there's there's lots of different menopause clinics that have got different websites, so you can get lots of information, do your research, have a list of your symptoms, and go in saying, I think I might be perimenopausal. I've got all of these symptoms. And if you take them written down, it just makes life so much easier for the GP. He hasn't got to say, have you got this? Have you got that? He can just have a look at that piece of paper, and then it's just a good way of opening up a conversation, really.
And if you've been tracking them, then you can say how often you're having them as well. You're not just going in saying, I've had them a few times. You can say, this is how many I've had over a month. So.
Yeah, and how long it's been going on for. So just be prepared.
Yeah, so before you go. And what are the most common things that people come to see you about when they think that they're perimenopause, or what are the most common things they're struggling with?
I mean, probably one of the most common things that I see women with are the women that are struggling with the low mood, and the GPs have just offered them antidepressants, and they say, I'm not depressed, I can't stop crying and I feel really sad, but I know I'm not depressed. And you can just tell by the way they're talking to you that they haven't got depressed. So I think the low mood, the mood swings, the brain fog, the worry that you've got dementia are really big problems. Women struggling with relationships, because life's quite stressful now. The average age of the menopause is 51, but the average age of retirement now is 67. So potentially women are working for 16, 17 years post-menopausal. And with life expectancy, a lot of people have got elderly parents they're caring for, teenagers. Women may have had their children slightly later because they've got a career. So they may have teenagers at home, teenagers that have gone to university, teenagers that went to university and came back due to lockdown. There's lots of pressure to earn money, to be working. The cost of living is going up all the time, so women can't afford to not work. And yet they're struggling, sort of trying to juggle all these different balls and then cope with menopausal symptoms as well. It's just knowing where to turn, really. And if you've got a friendship group and all of your friends appear to have sailed through the menopause without asking for HRT or asking for help, a lot of women think they've failed, and they haven't. Taking HRT doesn't mean that you're a failure. It just means that you're struggling without those hormones, and they need replacing to get rid of the symptoms.
That's it. You wouldn't feel like a failure if you needed insulin or you had another medical issue. You wouldn't compare yourself to your friends then, would you? But I don't know. I think a big thing is society it makes us compare. And like you said, in friendship groups, if you don't know anybody, it's very similar with lots of different things that happen in your life, really, a lot of different life stages. We all compare what's going on, and then there's this taboo around speaking out about it, isn't there, and asking for help. Absolutely. Or even saying, this is what I'm going through, and hopefully that's going a bit now.
Yeah, and hopefully it is. I mean, there's a lot more in the press, and people are much more aware of the menopause. But I think whichever stage of life, when you have young children, you're sort of comparing if they take their first words, their first steps, what exam results are they doing. There's so much pressure all the time to be comparing your children. It isn't fair on your children. And then I think again with the menopause, we're sort of, nobody else is taking HRT, so perhaps I should just man up and get on with it. I think we just need to change the way we think of the menopause, and rather than thinking of it as just being the change, but it's more, we need to think it's a long-term hormone deficiency. We're never going to start making estrogen again, and life expectancy is 83. And I read an article last week, 1 in 4 of us will now live to be 100, so potentially women are spending up to half of their lives post-menopausal with lots of those other pressures as well. If you went to your GP and he says you've got an underactive thyroid, you need to take the hormone thyroxine for the rest of your life, you'd take it and you would never want to stop it. So menopause is the same. It's a long-term hormone deficiency, and that's, if we can try and change our mindset about how we think about it, and then I think hopefully women will change the way that they go and get advice.
Definitely, like you say, it's when it's looked at as more of a medical thing rather than just something you have to go through. And I think because society says we should just put up and shut up through it, we just sort of accept that we maybe have to have low mood or feel a certain way, but then it has so much of a wide impact on everything else we do. You struggle to cope at work or to function properly because of those things, and taking medication could potentially help that, couldn't it? And then make it so much easier. So we've touched there briefly on HRT. There's been a lot in the news about it, and there's also, I think, still a lot of negative thoughts around it because of previous information that's been shared, hasn't there? And I think people are trying to change that view. What's your view on HRT, and what are the benefits of taking it?
I mean, there was a study in 2002 called the Women's Health Initiative, and it sort of hit the headlines. HRT causes breast cancer, HRT causes heart disease. And lots of women stopped taking their HRT, lots of doctors stopped prescribing it. The people that did that study have since admitted that that data was flawed. It was a very small cohort group. The women were all much older when they started HRT and all had underlying medical conditions anyway, but sadly mud does slip a little bit. But HRT is very safe. And nowadays, the majority of HRTs are taken from soybeans and yams. So they're what we call body identical HRT. They're readily available on the NHS, and they're no more expensive than the old types of HRT. It's not a cost implication that GPs don't prescribe them. So HRT is very safe. And not only does it help with symptoms, it had lots of long-term health benefits as well.
Yeah.
It protects you against osteoporosis, and women lose 10% of their bone density in the first 5 years of the peri-menopause. It protects against heart disease, and more women die of heart disease than anything else in this country. It protects against dementia, developing type 2 diabetes, and some forms of bowel cancer. So there's lots of long-term health benefits of HRT, as well as helping with symptoms.
That's it. And as you say, with life expectancy being longer, those things will help you for longer. So certainly, like for the risk of osteoporosis, the older you get, the higher the risk, isn't it? You are living till you're older. You want to be as protected as you can. And I think there's not enough information shared around those other benefits. I think it's still very biased towards of people still have of the mindset that it isn't safe, when actually there's so much more research showing that it is, isn't there? So
yeah,
it's trying to change that mindset. Like you say, it comes the mindset change of the menopause being a hormone deficiency that you treat then, doesn't it?
I apologise for my dog barking, the postman just came.
Don't worry, my cat's meowing to go out.
I'm gonna, he's just thinks he's a guard dog, and he's the smallest, fluffiest thing you've ever seen. Sorry about that.
Don't worry. So there's HRT that you would recommend, and is definitely becoming more widely accepted. Is there other things that people can do to help reduce some of the symptoms that they experience?
Yeah, of course. I mean, diet and lifestyle are really important, and that's one of the advantages of going to a private clinic like Simply Menopausal, because again, you have that 45 minutes not just to talk about the symptoms. It's not a case of just writing a prescription and sending you on your way. We can talk about smoking. Smoking doubles your risk of breast cancer. We can talk about alcohol, and how much alcohol women drink. A lot of women find that their tolerance to alcohol changes, and that it brings on the flushes. Whereas some women start drinking more to help with the sleep, and then they find it's not proper sleep, and they sort of have that sort of disturbed sleep, and then you just wake up feeling tired the next day. So talk about alcohol, talk about diet, and weight, exercise. Walking is very good for you. Walking is really good for bone density, because obviously it's really important to look after our bones. And while swimming and cycling are good for the cardiac, for your heart, it's that actually walking on the pavement, that sort of pounding exercise, that's really good to help with bone density. Vitamin D, which we can get lots of today because the sun is shining. But again, there's not enough sunshine generally in this country in the winter, so I advise all adults over the age of 40 to take vitamin D supplements, which you can buy from the chemist. Lots of fresh fruit and vegetables. Maybe a lot of women find they've gained weight during this time, and explain the process as to why they've gained weight, and some diet advice and exercise advice as well.
So there's a lot that people can do to help themselves feel better, isn't there? And sometimes I think if you're feeling down, it can seem a bit overwhelming to start making some of those changes and taking action. So kind of a combination, I guess, of a lot of those things is helpful.
Yeah, definitely. Yeah, and a lot of women suffer with low self-esteem, and then that sort of is coupled a bit with the weight gain. So you feel tired, so you eat more, and you gain weight, and you're feeling unhappy, and then you've got low self-esteem, so you eat more. So it kind of spirals out of control, really, and it can cause problems with relationships. And we are so terribly British quite a lot of the time, and just don't talk about sex and relationships and explain to our partners why we're feeling like we do.
Yeah.
Because a lot of marriages have ended just because of menopausal symptoms, which is really sad.
Yeah, and like you say, if there was more talking about it and less feeling worried about having those discussions, again, it comes down to that thing of as being very British and it being a bit of a taboo. to talk about these things and a bit of embarrassment, but actually by saying, I'm just feeling really low because of the menopause, or you know, my libido's down because of that, and this could help, you know, having those discussions just increases understanding. So it's not just women, is it, that need to have more of an understanding?
No, it affects everybody. It affects relationships, you know, work colleagues can be affected if you're not function quite so well at work. And it's really important that you talk about it in the workplace so people understand why you're feeling like you are. You know, and perhaps sometimes more flexible working if possible. It depends what job you do, but for a lot of women, you know, if they can be a bit more flexible about the work, or the workplace can be more flexible about their working hours, that all helps as well.
Yeah, which is good. And it's great that with your clinic they can come and have all of those discussions. They're much more likely to get a diagnosis, but also get that support from you as well.
Sure.
That information.
And I think it's quite important to talk to somebody that has got a medical background, you know, a qualified nurse or doctor with a special interest in the menopause, because other things go wrong with women in their 40s and 50s, and we can't put everything down to menopause. So it's really important that we can take you know, a full holistic assessment. Whereas there's lots of women out there that think they're menopause experts because they're menopausal women, and I know they have good intentions, but they charge a lot of money for consultations, and they have no medical background. It's really important that you have somebody that has a full understanding of, you know, any other comorbidities or any other causes for your symptoms as well.
Yeah, because as you say, you don't want to miss something, put it down to, oh, I've read a lot that it's the menopause, so you assume it's nothing else when you could be missing something that's more sinister there. Exactly. And also, especially around HRT, you have to check that it's something that's right for you, don't you, with somebody who is medically trained.
Oh yes, 100%. Yeah,
so
it's really important.
Not something that everybody can take without checking. So yes, it's always recommended to check with a doctor or a nurse about that. So what advice would you give to somebody who maybe is thinking that you've covered some of this already, that's starting with a perimenopause. You've talked about kind of tracking symptoms, keeping an eye on things. Is there any other advice that you would give them if they think they're starting?
Yeah, and I think just be organised, really. I mean, the average age of menopause is 51, but the perimenopause is the time leading up to that, and that begins somewhere in her early 40s. So I think it's so easy for women to think, well, I'm only 41, I'm too young for the perimenopause, where actually, you know, the average length of the perimenopause is 7 to 8 years. It can last several months or several decades. So just be organised, you know, sort of be thinking ahead, be thinking I maybe perimenopausal, or I might be approaching that time. Make sure that you're well read and understand what's going on. And it's time to sort of stand back and look at your life, really, and make sure you are leading a nice healthy diet and a healthy lifestyle. Make those health changes if possible.
And what would you say are the most common things that start, like that? I know everybody will be different, but the most common things that start, because if you said like, during the perimenopause you can still be having your periods, what other things would be a sign that maybe you are starting with it? Because I mean, my brain is going, I'm so forgetful. I'm forgetting words. And I was the same. I was thinking maybe I'm starting with dementia, but I'm 41 next month, and thinking, well, maybe it is just the start of it. What things are kind of a bit of a watch out, would you say, the first things that might start happening?
I think the fear that it's something more serious is quite a common reason why women don't go to their GP, because of the brain fog and the memory, and they think, I must have dementia, especially if they've got a family history of dementia. So they're afraid to approach the GP in case, you know, there is something more serious going on. Whereas most of the time it is a really common symptom. But just be aware. I mean, I see lots of ladies that will come for their review after starting HRT 3 months later and say, it's amazing, you know, the brain fog's gone, my hot flushes are gone, but my joints don't hurt anymore. And a lot of symptoms people don't associate as a perimenopausal symptom. They just think, oh, well, I had joint pain because I was old, not that it was part of anything to do with estrogen, and that estrogen can help.
Yeah. And like you said, just researching, because obviously I've done a lot of research recently on the menopause, and I'm really glad I had, because I wouldn't have had a clue. I think you just think it's something that happens when you get older, and you're not really aware of it. You just think, well, when it happens, it'll happen. And I'm much more prepared for research. And so would you say once you reach sort of your 40s, just starting to think about it, researching what kind of things you might find start happening, some of the symptoms, so you're aware?
Yeah, or even earlier. I mean, it's not optional. Every single woman will go through the menopause at some point in their life. So you know, the sooner you understand about it and know what's going to happen, and then you have sympathy for other people as well. You know, if you've got older work colleagues that maybe don't know so much about the perimenopause, you can always help them as well. So it's talking about it is so important, and it is such a topical conversation at the moment, which is just brilliant, because, you know, women are talking about it and understanding it and being prepared and doing their own research at the end of the day. And it's about informed choice, really. So if you can find as much information as possible about what's going to happen, and just be prepared.
Yeah, and like you say, talking to others, talking to your friends, because you may all be sort of going through it or starting to notice things, and actually it's a bit of a support network, but also they might have suggestions of, actually, I went to see my GP and I said this and I've already got support, or I've done this. I think just talking to other people increases your knowledge, doesn't it? And then you're a bit more informed to then go and start asking questions.
Yes, yeah, and think of it as a positive part of your life as well. It's so easy to concentrate on the negatives, and you know, it's no coincidence that the highest rate for suicide in women is between 45 and 55-year-old women. So that's quite worrying, and very few women go for promotion later on in life. But sometimes you need to stand back and focus and think, you know, you've got so much life experience and so much knowledge that you can share with other people, and potentially, you know, a good thing about the menopause is you're no longer fertile, so you can't have a baby. So sex is for fun, it's not just for reproduction. Maybe that your children have left home, so financially you might be a little bit better off. I mean, I know times are hard at the moment because the cost of living is so hard, but you're not mushing around going to school clubs, you're not picking children up hopefully every night. Your whole life isn't sort of programmed around different after school activities and things. So, you know, walking is free. We don't have to join a gym and spend lots of money. Go for a brisk walk, meet a friend and go for a walk, you know, take a flask to have a picnic. You know, there's lots of positive things that we can do about the menopause, and then we just need to think of it as a positive experience.
And a time that you can almost redefine yourself in a way, because when you have had children, you spend so long being their mum, you know, being known as so-and-so's mum, that you almost lose your identity a bit. And suddenly, you know, this could be a third to half of your life, couldn't it? So
Yeah.
see it as a time where actually you can start thinking about the things you want to do and the time you want to spend. Maybe if you've got a bit more time, not everybody necessarily does, but if you start having more time and who you want to be, what you enjoy and things, like you said, it's turning around. I think there's a whole societal thing that needs to be done there around turning it into a more positive time, so that everybody embraces it a bit more, rather than seeing it as going through the change, which is still
and just going to be old. Yeah. So, and as I say, you have got so much more time, and you can just do things that you want to do for once. And that doesn't mean you don't love your children, that you've abandoned them. You know, it's lovely to spend quality time with them as well. But they've become adults, and it's quite nice that you can just do something for you. Self-care isn't selfish. You know, there's nothing wrong with spending some time and looking after yourself. And you can't pour from an empty glass. So if you can look after yourself and you feel well, then you've then got more energy and more tolerance to give to parents and children and friends that might need your help and support.
That's it. You'll be much more able to cope with some of the symptoms that you're having, just because you're better rested, you've had time to yourself. So doing all of those things is so important. Thank you so much. Is there one last one key thing that you'd say if somebody is thinking that they are starting, that you would recommend to them, just as a final point?
Well, the main thing really is just don't feel sad that you're going through the menopause. Think of this as a positive transition in your life, and be prepared, and make sure you'll research, make sure you've got a full understanding of what's going on, and enjoy.
Oh, brilliant. Thank you so much. That's been so helpful. It's been really interesting and insightful for me as well. So thank you for your time. How can people find you if they want to come for an appointment or find information from you?
Yeah, so my clinic's called Simply Menopausal. So I've got my own website, simplymenopausal.co.uk. I'm based at a clinic in Leicester called The Health Suite. So again, you can look on their website, thehealthsuite.co.uk. I offer consultations face-to-face or via Zoom, so I can see anybody anywhere in the country if they want to make an appointment with me. My clinic's also on the British Menopause Society website, so if you go on there and look for accredited clinics, you'll find I'm on there. I've got a Facebook page and an Instagram page, so feel free to follow me on both Facebook and Instagram as well. And I've also got a private menopause group called the Simply Menopausal Community, which is a group for all women to empower. I just want to empower women to help and support each other so nobody feels like they're going through this alone. And my menopause group isn't just for my private patients, it's for anybody that feels they might be struggling with their symptoms and wants to know more information. Feel free to join me. I do Facebook Live every week with a live question and answer sessions. There's lots of little videos on there, and just trying to help and support people along their journey.
Oh, that's brilliant. And I'll share all the links to those when I post the video as well, so that everybody can get to them. But thank you so much. It's been really lovely chatting to you. And thank you
for having me. Take care.
You're welcome. Take care.
Bye. Bye.